Pallegra is caused by an insufficient amount of niacin or tryptophan in the diet. Pallegra may develop after gastrointestinal diseases or alcoholism. It's most common in people who have lots of corn in their diet. Niacin plays a crucial role in cellular respiration. It's found in yeast, liver, meat, fish, whole grain cereals, breads, and legumes.
Niacin is one of the essential human nutrients a healthy diet is required to have. Depending on age and gender, a recommended intake can be up to about 20 milligrams per day. Niacin overdoses are possible and are typically characterized by flushing of the face. It has a variety of uses in the body. One of the most important is the regulation of metabolism, since it is a precursor to NAD and NADP and NADPH, and it's also important in DNA repair, the construction of steroid hormones in the adrenal gland as well. It can be synthesized from tryptophan, an essential amino acid found in many sources of protein, and therefore typical dietary sources include meats, fish, as well as certain fruits and vegetables, nuts, and some fungi. Brewer's yeast contains an especially high amount of niacin, which was important in the history of helping with the disease of Pallegra, and modern energy drinks also typically include relatively high amounts of niacin.
The symptoms of Pallegra are delusions, diarrhea, inflamed mucous membranes, mental confusion, and scaly skin sores. It has also been linked to dementia.
Society's regard to Pallegra in the early 20th century is compared to recent ostracization of groups with acquired immunodeficiency disorder, or HIV/AIDS. Those without enough niacin in their system were often poor and easily shunned. Because of this, it was rarely studied. When it was studied, the researchers often worked under the false assumption that it was due to a toxin in corn. After Goldberger found this to be not true, research was able to move forward. This is a good example of experimental bias. While Dr. Goldberg originally treated Pallegra by prescribing a balanced diet or ingestion of a small amount of brewer's yeast, which contains niacin, it is now treated with niacinamide, a water-soluble formation of vitamin B3 that, unlike niacin, does not have to be metabolized. It is originally taken intravenously multiple times a day and later orally at a higher dose once a day.
Cases of Pallegra in the United States went undiagnosed until 1902. The records indicate that it had been going on in many regions for decades. In 1912, it hit its all-time high with 25,000 cases and a mortality rate of about 40%. The Public Health Services put Joseph Goldberger in charge of its research on the disease, and in less than a year, he concluded that the disease was dietary and non-infectious. Though he could not determine a definite cause, he recommended supplementing patients' diets with fresh meat, eggs, and milk, which greatly cut the number of cases since niacin is found in many different sources of proteins. He speculated that it was due to an amino acid deficiency and experiment with added different substances such as soy and yeast to otherwise corn-heavy and nutrient-poor diets. Soy did little to help, but yeast was extremely effective, and he concluded that a lack of protein was not the cause of the disease. In 1937, it was found that nicotinic acid, niacin, was the dietary factor whose absence caused Pallegra. Public awareness soon helped put an end to the disease. Food fortification plans were implemented in 1941, and bread that had been fortified with thiamine, niacin, and iron was distributed. By 1945, the disease was completely absent from the United States.
The study we focused on was effectiveness of food fortification in the United States, the case of Pallegra. This evaluated the role of niacin fortification of food supply in the U.S. to eliminate Pallegra from 1920 to 1955. They compared chronological changes in Pallegra deaths to changes in laws directed at fortification of cereal grain products with niacin and B vitamins. Economic growth and food availability were also compared to cases of Pallegra and Pallegra deaths.
This graph shows the number of deaths from Pallegra, represented by the black dots, versus the per capita disposable income, represented by the white dots, from the period of 1920 to 1955. Income data has been expressed in $1987 to compensate for inflation rates. As you can see, Pallegra deaths decreased as income increased. Mortality rates peaked just prior to the Great Depression around 1928. Poor or poverty-stricken individuals had a higher chance of contracting the disease because they did not have the means to buy nutrient-rich foods. Higher income allowed better food to be purchased. This graph helps to demonstrate the economical origin of Pallegra in the United States. This leads into the availability of food to people. This graph shows the changes in the availability of animal-derived foods that would be expected to have the most impact on niacin nutrition for the period 1925 to 1955. Plant-derived foods were not included in the data, but there was no meaningful change in the availability of plant-derived foods high in niacin, such as nuts and legumes, during the same period. The significance behind this graph is that there is a vitamin deficiency tied to the disease. As food became more readily available, the rate of people with pellagra began to drop. Both animal-derived and plant-derived foods helped to contribute to decreasing the mortality rates. Food became more available as the economy began to pick up after the Great Depression, mostly because people had a higher income and it became steadier over time. Higher income meant more nutrient-rich foods, and thus rate of mortality from pellagra began to drop.